So I propose tonight one act with two purposes. I propose we, all of us, embrace the selfless individuals at the National Association of Free Clinics. You know them. They conducted the mass healthcare free clinic in Houston that served 1,500 people. I want a healthcare free clinic every week in the principal cities of the states of the 6 senators key to defeating a filibuster against healthcare reform in the Senate. I want Senators Lincoln and Pryor to see what healthcare poverty is really like in Little Rock. I want Senator Baucus to see it in Butte. I want Senator Ben Nelson to see it in Lincoln. I want Senator Landrieu to see it in Baton Rouge. I want Senator Reid to see it in Las Vegas. I'll donate. How much will you donate? We enable thousands of our neighbors to have just a portion of the bounty of good health. And we make a statement to the politicians. Forgive me, William Jennings Bryan. You shall not press down upon the brow of America this crown of insurance. You shall not crucify mankind upon a cross of blue. We think these events will be firmed up presently. You'll be able to link from our website. Trust me, I will remind you. Because in one party, in one demographic, in one protest movement, we are all brothers and sisters. We are united in membership in the party that insists that every chance at life be afforded to every American seeking that chance. We are united in membership in the party that insists on the right of everyone to the startling, transcendent blessings of the technological advance of medical science. We are united in membership in the party that is for life, that is against death, that is for lower premiums, that is against higher deductibles, that is for the peace of mind that can be provided only by the elimination of the fear that cost will decide whether we live or we die. Because that's the point, isn't it? It is hard enough to recover, to fight past pain, and to stave off death, if just for a season, or a week, or a day. It is so hard that eventually, for you, for me, for this president, for these blue dogs, for these protesters, it is so hard to recover that for all of us, there will come a time when we will not recover. So why are we making it harder? On behalf of both of the Olbermans, good night and good luck.
With extreme pressure being applied to Democrats in Washington from the left. You have just heard the program-length special comment from Keith Olberman on MSNBC's Countdown, intended, obviously, to dramatically increase political pressure for health care reform. He's specifically talking about a technique that would increase political pressure on 6 Senate Democrats who are key to allowing a vote on health reform. The proposal, as Keith said, is to hold massive free health clinics weekly in the capital cities of the states represented by these 6 key Democratic senators. Senators Blanche Lincoln and Mark Pryor of Arkansas, Senator Max Baucus of Montana, Senator Ben Nelson of Nebraska, Senator Mary Landrieu of Louisiana, and Senate Majority Leader Harry Reid of Nevada. As has occurred in other states, doctors and nurses would donate their time to provide free care to thousands of constituents of these senators, to regular Americans in these states who cannot afford health care as it is provided by the health care non-system that we've got now. A similar free clinic held in Houston last month by the National Association of Free Clinics drew 1,500 people looking for treatment. The strategy at work here is that if funds can be raised to hold clinics like these in Arkansas and Montana and Nebraska and Louisiana and Nevada, it will be a way of doing well by doing good. Americans who are unserved by the current system will get some health care. And this dramatic, heart-wrenching means of providing it to them could shame their senators into getting out of the way of reform. Now, to shame them into stopping what is presumed to be a Republican filibuster of any health reform bill. Now, if seeing thousands of their uninsured or underinsured constituents in need of care isn't enough to shame those Democratic senators into allowing a vote on health reform, there is another way to break a Republican filibuster. And here we have some news for you. We can report exclusively tonight that 2 major power brokers on the left have told MSNBC that they are encouraging a Senate strategy now in which the leadership would revoke chairmanships and other leadership positions from any Democrat who sides with a Republican filibuster to block a vote on health reform. Regardless of how individual senators would vote ultimately on the bill, committee chairman or subcommittee chairman who allowed Republicans to force a 60-vote requirement for passing health care, who filibustered, Democrats who voted with a Republican filibuster, under this type of strategy would be in danger of losing their chairmanships. That would be the Senate equivalent of busting a lieutenant colonel down to private. This is cracking heads time in the Democratic Party right now. This is arm-twisting, vote-counting, are you a real Democrat time for the proponents of health reform. If senators aren't themselves shamed or pressured by their constituents into getting out of the way of reform, if threats to revoke leadership positions aren't enough to convince senators to get out of the way of reform, there is yet still even another option. It's through a boring-sounding Senate rule called reconciliation, which essentially just blocks a filibuster for specific kinds of bills. Under reconciliation rules, Republicans couldn't force a 60-vote requirement. The bill would have to pass with just 51 votes or just 50 votes if Vice President Joe Biden was to provide the tiebreaker. If the reconciliation rules were used, there couldn't be a filibuster. There wouldn't have to be 60 votes. And health reform would have a very good chance of passing. Actually, it would have a better than very good chance of passing. And so opponents of health reform are now trying to make using reconciliation rules sound dastardly, unprecedented, crazy. Who would ever do such a thing? It's never been done before. Here, for example, is Republican Senator James Inhofe of Oklahoma speaking on conservative talk radio this week.
I think they're going to have a hard time doing reconciliation because that would be the first time on a major tax bill that that's been done in our nation's history. And I don't think that Harry Reid really wants to do that.
That would be the first time reconciliation's been done on a major tax bill? That would be the first time? Actually, you remember that $1.3 trillion tax cut, mostly for rich people? President Bush's first tax cut? That was passed through reconciliation. Also, the second Bush tax cut, another $350 billion. That was also passed through reconciliation. So when Senator Inhofe says no major tax bill has ever been passed through reconciliation, maybe he's talking about some other country. I don't know. But then there's Democratic conservative Senator Ben Nelson of Nebraska, who has said repeatedly that Democrats should not expect him to go along with some crazy plan to pass something under reconciliation. No, Ben Nelson says he would not vote for something under those crazy reconciliation rules. That would be way too radical. Well, Ben Nelson, of course, not only voted for the first Bush tax cut that was done under reconciliation, when they did it again for the second Bush tax cut, Ben Nelson not only voted for that bill under reconciliation, but he was a critical vote. He was vote number 50. Vote number 51 that passed that thing was then Vice President Dick Cheney. The main obstacle to passing health reform right now is not just Republicans. It is conservative Democrats in the United States Senate, like Ben Nelson, like Blanche Lincoln, like Mark Pryor, etc. And being a conservative Democrat standing in the way of health reform, it seems like it's starting to become a lonely, increasingly uncomfortable place to be standing.
I don't want this to work. I hope he fails.